Have you ever felt more tired than usual, noticed your ankles swelling, or found yourself out of breath doing something simple like walking to the mailbox? Most women over 60 dismiss these as just getting older. But the truth is, these can be silent warning signs from your heart. And missing them could mean ignoring the very signals that protect your life. Stay with me, because in this video, I am going to reveal the 5 silent heart warning signs every woman over 60 must notice. They are subtle, easy to overlook, but knowing them could make the difference between catching a problem early and facing a dangerous complication later. I am Dr. Lisa Perriera, a gynecologist with over 30 years of experience caring for women through menopause and beyond. Here on Elder Care Wellness, we talk about what truly matters for women after 60: circulation hormones, memory, intimacy, bone strength, and the daily choices that help you age with confidence and vitality. And today, we are focusing on your heart, because heart disease is the #1 killer of women after menopause. Yet so many women do not recognize the signs until it is too late. Here's what makes this even more concerning. Women's heart symptoms often look very different from men's. Men might feel crushing chest pain, women often don't. Instead, the signs show up as tiredness, dizziness, nausea, or pain in places like the jaw or back. According to the Mayo Clinic, these differences delay diagnosis and treatment for thousands of women every year. Let me share a quick story. Margaret, age 66, came to my office complaining of unusual fatigue and mild nausea. She thought it was her stomach, maybe stress. But when her doctor examined her, they discovered she had already suffered a small heart attack. She never once had chest pain. The only clues were those silent, easy-to-ignore symptoms. Stories like Margaret's remind us why knowledge is power. If you can spot the 5 silent signs early, you can talk to your doctor, get the right care, and protect your heart before it's too late. So here's how we'll break it down. First, we'll uncover why women's heart symptoms often look so different from men's. Then I'll walk you through the 5 silent warning signs one by one with real examples. And finally, I'll share practical steps you can take right now to protect your heart health. Before we dive in, I'd love to hear from you. Have you ever had a symptom like unusual fatigue, shortness of breath, or swelling, and brushed it off as just aging? If yes, type me in the comments. If you've never thought about it before, type no. Either way, your answer may help another woman watching realize she is not alone. All right, let's begin. To understand these warning signs, we first need to uncover why women's hearts send different signals than men's, and why those signals are so easy to miss. So let's begin with the question, why do women's heart warning signs look so different from men's? The answer comes down to hormones and biology. Before menopause, estrogen helps protect a woman's heart by keeping blood vessels flexible and supporting healthy blood flow. But after menopause, when estrogen levels drop, that protection fades. The arteries become stiffer, smaller vessels are more likely to narrow, and circulation changes in ways that create unusual symptoms. According to the Mayo Clinic, women are more likely to have blockages in the smaller arteries that feed the heart muscle, not just the major ones. This means their warning signs often spread out, showing up in places like the stomach, jaw, or back. And because these symptoms don't match the classic chest pain image of a heart attack, they are often missed or misdiagnosed. That is why it is so important for women over 60 to learn what these silent warning signs look like. They may not scream at you, but they whisper in ways that can be just as dangerous. Silent warning. Sign number 1. Unexplained fatigue. This is one of the most common and most overlooked signals. If you find yourself unusually tired after simple activities like climbing the stairs, carrying groceries, or even folding laundry, your heart may be struggling to keep up. One of my patients, Helen, age 70, came to me saying, I just don't have the energy I used to. She assumed it was normal aging. But after further evaluation, doctors discovered her heart was not pumping efficiently. The only clue was exhaustion that did not match her activity level. Here's the key. Normal tiredness improves with rest. Heart-related fatigue often does not. If you wake up tired after a full night's sleep, or if light activity leaves you drained, it is time to pay attention. So let me ask you, have you ever felt unusually exhausted from something simple like walking across the room or preparing a meal and thought to yourself, this must just be getting older? If so, type yes in the comments. If not, type no. Your answer could help another woman recognize something she has been ignoring. And here is the important part. Fatigue is just the beginning. The next silent warning sign often disguises itself as stomach trouble, and it has delayed diagnosis for countless women. Fatigue may be the first sign, but it is far from the only one. The next two signals often confuse women the most because they look like ordinary problems you would never link to the heart. Silent warning. Sign number 2. Indigestion or stomach pain. Many women describe a burning pressure or discomfort in the upper stomach. They assume it is acid reflux gastritis or something they ate. But according to the Cleveland Clinic, heart symptoms in women often radiate into the upper abdomen instead of the chest. Mary, a 69-year-old grandmother, came to my office saying, I keep getting this heavy feeling in my stomach after meals. I thought it was indigestion. She tried antacids, cut out spicy food, even stopped drinking coffee. But the discomfort kept returning. When she finally saw a cardiologist, tests revealed serious blockages in her arteries. What she thought was her stomach was actually her heart. Here is what to remember. If stomach discomfort comes on with activity, or if it feels heavy pressure-like or persistent, especially if antacids don't help it, is worth checking your heart. Let me ask you, have you ever had unexplained indigestion or stomach pressure that didn't improve with usual remedies? If so, type stomach in the comments. If you haven't, type clear. Sharing your answer may help another woman realize she is not alone. Silent warning sign number 3. Shortness of breath. Another common but overlooked signal is feeling winded too easily. If walking across the room, climbing a few steps, or even lying flat in bed leaves you short of breath, your heart may not be pumping effectively. When that happens, fluid can back up in the lungs, making breathing harder. Susan, age 72, thought she was simply out of shape. She told me, I get out of breath just making the bed. I guess I'm slowing down. But her doctor discovered early heart failure. Once treated, Susan's breathing improved, and so did her energy. The difference is clear. It is normal to breathe harder during exercise. It is not normal to feel out of breath during light activity or while resting. Think about your own experience. Have you noticed yourself catching your breath during simple tasks or needing extra pillows at night to sleep comfortably? If yes, type breath in the comments. If no, type steady. These are two of the most easily misunderstood warning signs because they mimic stomach and lung issues, but they can also be the heart's quiet cry for help. And here is the cliffhanger. The next sign shows up far from the chest in places you might never connect with your heart, and missing it can delay diagnosis for months. So far, we have looked at fatigue, stomach trouble, and shortness of breath. Now let's talk about two warning signs that often surprise women because they show up far from the chest. Silent warning. Sign number 4. Pain in the jaw, neck or back. Many women expect heart pain to be in the chest, but in reality, signals can travel through nerve pathways and show up in other areas. That is why discomfort in the jaw, neck, or upper back should never be ignored. Linda, age 71, told me she woke up several nights in a row with a dull ache in her jaw. Her dentist could not find any dental problem. She thought it was arthritis in her neck. But further testing revealed restricted blood flow to her heart. The pain was referred, meaning the heart sent the warning signal through nerves that ended in the jaw. Here is the takeaway. If you feel pain or pressure in the jaw, neck, or back that comes on with activity and eases with rest, it could be your heart, not your muscles or teeth. Let me ask you, have you ever had unexplained pain in these areas and thought, it's just part of aging? If yes, type ache in the comments. If not, type fine. Silent warning. Sign number 5. Swelling in the feet. Ankles or legs. The last sign is one many women notice but rarely connect to the heart. Swelling in the feet or ankles, especially in the evening, can mean your heart is not pumping strongly enough. When blood flow slows, fluid collects in the lower body. Nancy, age 74, noticed her shoes were tighter at night. She assumed it was from standing too long while cooking. But after medical evaluation, doctors diagnosed early heart failure. Once she began treatment, the swelling improved and her energy returned. Here's what to remember. Swelling that disappears quickly after resting may not be serious, but swelling that returns daily, worsens over time, or comes with shortness of breath or sudden weight gain is a signal your heart may be struggling. Think about your own body. Have you noticed your ankles or shoes getting tighter by the end of the day? If so, type swell in the comments. If not, type steady. These last two signs are easy to dismiss as arthritis or aging, but they can be powerful clues that your heart is asking for help. Now that you know all 5 silent warning signs, you may be wondering, what should I do if I notice them? In the final part of this video, I will recap the signs, share the next steps to take if you recognize them in yourself, and leave you with a hopeful message about protecting your heart after 60. Stay with me, because this final step can give you the peace of mind you deserve. We have now uncovered the 5 silent warning signs that every woman over 60 must pay attention to. Let's recap them quickly. Number 1 was unexplained fatigue, when light tasks leave you unusually drained. Number 2 was indigestion or stomach pain that does not go away with simple remedies. Number 3 was shortness of breath during light activity or while lying down. Number 4 was pain in the jaw, neck, or back that comes and goes with effort. And number 5 was swelling in the feet, ankles, or legs, especially in the evening. These may sound subtle, but together they can be powerful warnings that your heart needs attention. The most dangerous thing you can do is brush them off as just age. So what should you do if you notice any of these signs? Step 1. Write them down. Keep track of when they happen, how long they last, and what you were doing at the time. Step 2. Talk to your healthcare provider. Even if you feel embarrassed or unsure, it is always better to get checked than to stay silent. Step 3. Do not wait. Heart symptoms in women can be quieter than in men, but the risks are just as real. Acting early can save your health and your life. Here is the hopeful part. Your heart is resilient. Even after menopause, small changes make a big difference daily. Walks, a balanced diet, staying hydrated, managing stress, and keeping up with regular checkups. According to the Mayo Clinic, women who stay active and attentive to their health can lower their risk of heart disease by more than half. That is a powerful reminder that you have control. Think of your heart as a lifelong companion. It has carried you through every season of life, and with care, it can carry you forward into many more years of strength, connection, and joy. So let me ask you, which of these 5 warning signs surprised you the most? Type your answer in the comments below. Sharing your thoughts might help another woman recognize a symptom she has been ignoring. And if this video gave you clarity, please like it, subscribe to Elder Care Wellness, and share it with a friend or sister who may need this message. Because here at Elder Care Wellness, we are more than a channel. We are a safe and supportive community for women over 60, where knowledge, connection, and healthy aging come together. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or personal concerns, please consult your healthcare provider. Your well-being deserves personalized care.